Hello, this is Dr. Gary Billman. I'd like to discuss 5 common questions or misconceptions about testosterone replacement. These are very good questions. They come up a lot, and I'd like to address them. The first question has to do with dependency. Doc, if I start testosterone, will I need to stay on it long term? The answer is no. When one takes testosterone and adds it to the body temporarily, the body's production of testosterone slows down, testicles can get a little bit smaller, but should one decide for whatever reason to stop testosterone replacement, the testicles recover a matter of weeks, sometimes months, and you don't become dependent on it. Alternatively, bodybuilders, which we'll get to in a moment, sometimes the doses and the way it's delivered can lead to dependency. But the types of therapy and the doses that we use in common clinical practice doesn't lead to a dependency. Second common question has to do with aggressiveness. There's a certain association with testosterone replacement and aggressiveness, namely roid rage. And so the question is, Doc, will this make me more aggressive? And the answer is no. Testosterone replacement won't make men more aggressive. 20-year-olds who take testosterone in the gym and go from very good levels to super physiologic levels can get what we call roid rage. But the doses that we do don't make men more aggressive, can make men more assertive, feel better, but certainly not more aggressive. Third question has to do with heart disease, thromboembolic problems, strokes. Does testosterone replacement increase the chance of heart disease, strokes, thromboembolic problems? The answer is no. There's good evidence that testosterone is safe for the heart, lowers, in fact, there's good data, it lowers the risk for heart attack and stroke, so one can take testosterone replacement safely. Fourth question is, Doc, is this steroids? And the short answer is yes, but not exactly. So I have patients who compete in athletics and competitive sports, and I'll tell them if there is drug testing, so to speak, this testosterone will come up as a banned substance. The typical steroids that are used for bodybuilders and other athletics has to do with similar products, but not the same. The doses are very different. Many of them are oral, and there's cycles or stacking where they stop and start testosterone replacement to trick the body. So in short, it is steroids, but it's not exactly as associated in common language. Last question has to do with weight gain. Will testosterone cause me to have weight gain? The short answer is initially perhaps, long-term not. So testosterone is a steroid, can lead to some fluid retention initially, but the data on testosterone replacement leads to better lean muscle mass and can in fact help with weight gain. So I hope this helps answer 5 common, what I call questions or misconceptions about testosterone replacement. Thank you very much.